have irritable bowel syndrome, or IBS, you know how much it can feel like it's running your entire life. But what if you could build your own personal toolkit to manage it? Well, today, we are going to explore some really practical, science-backed strategies that you can use right alongside your medical treatment to put you back in the driver's seat. Let's get right into it. Does this feel familiar? That uncertainty, the discomfort, the way it can just dictate your plans for the entire day? Yeah, it is incredibly frustrating. But what if you could build a personal set of tools to manage those symptoms and finally take your day back? That's exactly what we're here to do.
And listen, this isn't just wishful thinking. This is actually backed by science. A 2016 study found that when patients paired self-care with their regular medical treatment, they saw a real, measurable improvement in their quality of life and a decrease in their symptoms. That's the powerful idea we're unpacking today.
So, what do we actually mean by this self-care promise? Think of it as creating your own personalized strategy. It's not about finding one single magic bullet, but about building a set of habits and tools that helps you wrestle back control from your symptoms.
First up, let's talk about diet. This is usually the first place people look for relief, and honestly, for good reason. We're going to look at 3 key tools you can use to start figuring out what works for your body and what might be a trigger.
Our very first tool is a classic: fiber. In fact, the American College of Gastroenterology strongly recommends increasing fiber to help ease IBS symptoms. It can be especially helpful if you're someone who deals with constipation.
But here's the thing, not all fiber is created equal. The focus here is on soluble fiber. You know, the kind you find in things like oats, beans, and a lot of fruits. This type of fiber can be really effective for improving bowel movements. A lot of people also have success with a supplement like psyllium husk.
Now, this next part is absolutely crucial. You can't just jump in and add a ton of fiber all at once. Ramping it up too quickly can totally backfire, causing more gas and making your symptoms even worse. The key is to start low and go slow. Just add 2 to 3 grams per day until you hit that sweet spot of around 22 to 34 grams.
Okay, let's move on to our next tool, playing detective with common food sensitivities. Sometimes, specific things in our food can be the culprits behind those flare-ups, even if you don't have a full-blown allergy. 2 of the most common suspects are gluten and lactose. For some people with IBS, gluten can make symptoms worse even if they don't have celiac disease. And other times, what feels like IBS might actually be lactose intolerance. A doctor might suggest cutting one or both out for a little while, just to see if you notice any improvement.
And that brings us to our third and maybe the most structured dietary tool, the low-FODMAP diet. You've probably heard of this one. It's a pretty powerful strategy that many doctors recommend for really pinpointing specific food triggers.
So what in the world are FODMAPs? Well, the name is just a big acronym for a group of certain carbohydrates that are pretty tough for our bodies to digest. For people with IBS, they can end up fermenting in the gut, and that's what triggers all that gas, bloating, and pain.
So this diet involves temporarily avoiding foods like garlic, onions, certain fruits like apples, plus a lot of dairy, wheat, and beans. But let me be super clear about this. This is not a forever diet. It's a short-term elimination phase to let your system calm down. And then you carefully reintroduce foods to discover exactly what your personal triggers are. All right, we've talked a lot about diet, but that's really only half the story. Managing IBS isn't just about what you eat. There is this incredibly powerful connection between your mind and your gut. And for so many people, stress is a major trigger for flare-ups. And this brings us to tool number 4, active stress management. You know, they call it the gut-brain axis for a reason. When you're stressed out, your gut feels it, like immediately. So learning how to calm your nervous system isn't just good for your mind. It can have a direct, calming effect on your digestion too. And the great news is there are so many fantastic, proven options to explore. Simple things like belly breathing, mindfulness meditation, or progressive muscle relaxation, where you tense and then release different muscle groups. Even just taking a moment to visualize a peaceful place or using a self-guided workbook based on cognitive behavioral therapy can make a huge difference.
Our 5th tool is gentle exercise. Moving your body can help you feel better both physically and mentally. And for IBS specifically, yoga can be especially beneficial because it often wraps up movement, meditation, and regulated breathing all into one practice.
And check this out. This is where it gets really interesting. A 2018 study put this to the test. They compared a low-FODMAP diet to a yoga program for people with IBS. And the result? Both were effective at reducing symptoms.
It's just powerful proof that you have multiple paths to relief, whether that's through diet or through mind-body practices.
Okay, we're almost done building out our toolkit. Let's just add a couple more helpful items that you might want to consider when you need some symptom relief.
Tool number 6 is peppermint oil capsules. Peppermint oil is thought to help relax the muscles of your gut, which can ease the pain and cramping that comes with IBS. Research actually suggests it can be pretty effective for pain relief. But, and this is a very important tip, if you take antacids, you have to make sure you take them at a different time than your peppermint oil capsules. The antacids can actually break down the capsule's special coating too early, which can unfortunately lead to heartburn.
And all of this brings us to the most important principle of all, the one that really ties every single one of these tools together. Listen to your body. Whether you're adding more fiber, trying out yoga, or reintroducing a food after the FODMAP diet, you have to pay close attention. Your body is giving you constant feedback, and it is the most valuable guide you have. So you now have this whole collection of tools. The path forward is all about working with your doctor to pick the ones that are right for you and weaving them together into a personal, sustainable plan.
And it is so important to remember this. Self-care is not a replacement for medical care. It's a powerful partner. These strategies work best when they're part of a complete treatment plan that you've built together with your doctor.
So, we have filled your toolkit with options. Everything from fiber and FODMAPs to yoga and stress relief. The journey to managing IBS is a personal one, and it always starts with taking that first step. So, looking at everything we've covered, what's the one new tool that you feel inspired to try first? Thanks for joining me on this explainer.